and how we do that. This will all change, whereas our current clinics, we pre-register and all the paperwork is done and out of the way. We won't have an opportunity to do that for the H1N1 clinics.
Okay.
So as people attend the clinics, there will be a paperwork process that has to be gone through.
Okay, so a basic registration when they arrive.
Right.
Okay.
There's likely to be appointments that are made for a certain block of time.
Okay.
And that may be done either through a phone call or an online service, depending on who's providing the clinics. But that's what we're talking about, is having an online registration for registering for maybe a 15-minute block of time when you would come in and get your shot. But then once you get there, you're still going to have to go through a consent process, signing the consent forms, either for an adult if it's an adult, or for the child if it's a child. The adults would have to be there. So there would have to be a responsible party for that child. The guardian or parent has to be there with the child to do that. And then because most of this population, or at least much of this population, has never been vaccinated for flu before, that's likely to slow down the vaccination process itself. The nurses and medical providers are going to have to screen the individuals to make sure that they don't have any contraindications for the vaccine, like a severe allergy to egg or something like that, and to explain the vaccine and then provide the vaccine. So the clinics are likely to be slower than we're used to. The good side is that, as you said before, most of these people haven't been through clinics, so they don't know what we've experienced in the past. So that's a good thing. But it may be slow. There may be a lot of questions.
Right. And as someone, and as you both have, having run clinics in the past for an adult population, when a family comes in with 1, 2, or 3 children, there are just normal children responses that will be amidst the crowd, amidst the mix, so to speak, of things to try to address and to help the kids to feel comfortable and not be nervous and not feel anxious. So that just adds this other layer that you haven't typically had to deal with before. Right.
Yeah, and we would encourage individuals to seek out, through their private doctors and providers, because then they avoid some of those settings, hopefully, if the vaccine's available through their pediatrician or their private doctors. Try that first.
Okay. Now, you alluded to, folks who may have had, serious egg allergies, and, Somni, maybe you can speak to this a bit. Are there, let's start first with who these key target groups are again, and then within that, are there some people who maybe shouldn't get this vaccine for some reason?
Okay, the key target groups include pregnant women,
children
from the age of 6 months to 24, healthcare workers, licensed healthcare workers. So we're looking at nurses, physicians, those who would have contact with sick individuals, including emergency response individuals.
We saw that with SARS, didn't we? That was the population that really was very seriously affected. So it makes perfect sense that the healthcare workers need to be protected because they're most likely to be in such direct contact.
And at this time, the vaccine is not available for those under 6 months of age. So if you have caregivers who are watching children at home, or even daycare attendees, we recommend that those individuals who are caring for those very young children also get the vaccine. In addition to those 25 years and above who have serious medical issues, and some of them could include diabetes, asthma, immunocompromised, going through cancer treatments, some other issues. So it's very important that you seek your physician and get their advice as to whether you would be appropriate for this vaccine.
Now, within that, are there some folks who still should not get it, even if they fit that category?
As we mentioned earlier, this novel H1N1 vaccine is made in the same way as a seasonal flu vaccine. So if you have allergies to eggs, if you've had other complications with the regular flu vaccine, you should seek your medical provider. You probably should not get this vaccine. Again, as we mentioned earlier, there are other precautions that you could take to help prevent getting the flu.
Right. Now, how will these clinics be publicized? How are we reaching out to this much larger audience now to inform them of when these clinics will be held? Whomever would like to address that. You both have maybe different ways of reaching out.
You could definitely go to our website. We'll also be having postings in the newspaper and radio and trying to let everyone know currently where our clinics will be held and what the hours are. Traditionally, as Kevin had mentioned, there probably will be an appointment system. However, so we'll provide additional information as that is available. When the vaccine comes, we have a little better idea as to how we'll be able to plan those clinics.
Okay. Kevin, is that
it would be the same. On the website, hopefully radio stations, newspapers, posters, flyers,
Any
however we
which
can
way
get the...
we can. Somni, I have read that there's been some concern about the H1N1 vaccine just because it's a new vaccine. Is that something, do you have any comments about that, or should there be concerns?
What's different with this vaccine is that it's actually not new in the sense because it's made in the same manner as the seasonal flu vaccine. The seasonal flu vaccine has 3 different strains in it, and it's made months in advance. And unfortunately, with this situation, we did not detect this H1N1 vaccine early enough to include it with the seasonal flu vaccine. So which is why it's a separate vaccine. So it's made in the same way, but the seasonal flu vaccine has 3, and the novel H1N1 vaccine has 1 strain. So that's why they're the same precautions, they're the same contraindications, and the same group of people are able to take them.
Okay, so you're not really seeing, so there really is no cause for concern, is what you're saying. There's really nothing unusual about how this vaccine
Nothing
has
unusual,
been
however,
produced.
since again it is a new strain, the studies over the summer were done to find out whether children or adults would need to have 2 shots versus 1 shot to make sure that our body responds in a way to provide us with the best protection.
Okay, great, thank you. Kevin, should people get this vaccine? What is the message that comes from public health?
The message from public health is yes, people should get the vaccine. And I understand that there is some qualms about whether or not the pandemic is real or H1N1 is real. Thankfully, thus far we've seen relatively mild illness with this flu. But I think it's important for the public to keep in mind that the CDC is now estimating that in excess of 95% of the flu that is in our country is H1N1. And there are some people who will have serious illness, and there will be some people who will die from this flu because it is an influenza virus. So, as so many just said, the vaccine is